I'm frequently asked who should be taking aspirin, and the recommendations are very clear that people who are age for men 45 to 79 and women 55 to 79 who have increased cardiac risk by virtue of blood pressure, cholesterol, smoking, other risk factors should be taking a daily baby aspirin. A baby aspirin is about a quarter or 81 milligrams of a full-size adult aspirin. So you can buy baby aspirin as small pills, or you can cut a regular adult aspirin in 4 pieces. Aspirin works in a number of ways that we understand. It's an old drug, been around for a long time, but with relation to heart disease, heart attack, and stroke, it's believed to work through thinning of the blood, that is, keeping clots which might block arteries from forming as easily. Aspirin shouldn't be used in some types of people. People, for example, who are allergic to aspirin, an obvious thing. People who have stomach ulcers, because aspirin may make that worse, or people that have other bleeding problems or taking other drugs that may thin their blood and cause them to bleed more. They shouldn't be taking that with aspirin. One of the continuing problems with people who are having a heart attack is delay in getting attention. People want to think about other things. The cold pizza I ate for lunch is the reason I'm having chest pain or discomfort, and they delay. And delay leads to more damage of the heart because of the many things we can do now in a heart attack that saves and protects heart muscle from being permanently damaged. Those things work best the earlier you implement them, the earlier you start it. And people wait too long, and that's a serious problem. In most emergency rooms, they're very sensitive to this and would rather see you and tell you don't have a problem, that it really was the cold pizza, as opposed to having you have a severely damaged heart. Much of our understanding of delay times certainly comes from animal studies where you create a heart attack and you then try different therapies, and that's where it was learned that the earlier the therapies are applied, and we're talking minutes to hours, the more effective the therapies are. And also studies of people who've had a heart attack and survived, and the sources of delay that they have, frequently trying to think of other reasons why this isn't a problem. And we encourage not only people to be sensitive to their own symptoms, but their relatives, spouses, push them to get attention for something like heart, chest pain symptoms. If people took aspirin according to guidelines, then the heart attack rate in men and stroke in women and heart attack as well in women would decline significantly. Clinical studies, trials that have been done to look at this, see rate reductions of anywhere from 10 to 25%, which is substantial. Now, there are other things that cause heart attacks and strokes that aren't affected by aspirin, but a significant portion of them are affected and improved by taking it.